Today on Investigate TV Plus, the U.S. Armed Forces are seen as a bastion of strength ready to defend our country. I'm Tisha Powell.
And I'm Lee Zurich. But what happens when service members struggle with their mental health?
Part of the issue is that a lot of people on active duty don't get the help in a time of crisis.
One family's tragic story and their vow to keep their son's memory alive by saving other service members.
It provides me the strength to continue the work that we're doing.
Plus, fighting cancer in the 21st century. The technology giving patients a second shot at life.
I think I got very lucky. It seemed like everything is kind of falling into the right place.
And the buzz about a vaccine that could help save a species.
Absolutely incredible the way it works.
In-depth stories that inform and inspire. You're watching Investigate TV Plus. They raised their hand to fight for our country.
But many of our military service members face an unseen battle. According to the Department of Defense, between 2016 and 2020, more than 450,000 active duty service members were diagnosed with at least one mental health disorder. The DoD's annual report on suicide tracks another significant concern. Nearly 500 service members took their own lives in 2022. 331 of those were active duty.
We should mention support through the military crisis line is available 24 hours a day. Just dial 988 and then press 1.
We also want to go in depth on a new resource available for those in uniform. It's called the Brandon Act.
Reporter Heather Graff explains how the family behind it hopes to save lives and reduce the stigma of seeking help.
I know he's close.
We caught up with Terry and Patrick Caserta on one of many trips they've made to the nation's capital.
It provides me the strength to continue the work that we're doing.
Do you wear that every day?
Every day.
The military dog tag Terry wears around her neck, serving as a reminder of why they're here. A reminder of who they're fighting for.
He was amazing. He was always helping everybody.
He was the kindest, nicest person I've ever known, and he had a smile that made you want to smile.
Brandon Caserta was their beloved son, just 21 years old, when he took his own life while serving in the Navy. His parents say it happened as a result of relentless bullying and hazing within his unit.
He sacrificed himself to draw attention to his command.
How soon after his death did you decide we have to do something about this?
We sat down in August of 2018, which is a little less than 2 months after he died. We knew from his final words to us that he wanted us to do something. The only thing that we could do as parents is create a law to help save our service members.
The Casertas then set out to do just that, and upon hearing their story, Massachusetts Congressman and military veteran Seth Moulton sponsored a bill now known as the Brandon Act.
Part of the issue is that a lot of people on active duty don't get the help in a time of crisis that they need. The Brandon Act aims to change that, and it simply wouldn't have happened without their extraordinary advocacy in memory of their son.
The legislation is designed to improve the process by which a member of the armed forces may be referred for a mental health evaluation. It requires a referral be made as soon as someone self-reports, while also allowing service members to seek help confidentially and, if necessary, outside the chain of command, at any time, for any reason.
If they choose to let their command know, that's fine. Their command can't retaliate against them. It's to keep people healthy, because mental health is health, period.
For Patrick and Terry, it's painfully personal, but experts say mental health struggles in the U.S. military are a pervasive problem. The Cost of War Project at Brown University estimates about 30,000 active duty personnel and veterans who served post 9/11 have died by suicide. That's at least 4 times the amount killed in combat during that same era.
It's excruciating.
Scary statistics that made this timeline excruciating as well. The Brandon Act was first introduced in June 2020 and signed into law in December 2021. But it would be 16 more months before the Department of Defense finally announced the policy's implementation in May 2023.
How frustrating was that delay?
We didn't understand. We could not understand why it wasn't being implemented on the DoD level.
And do you believe that cost lives?
Oh, absolutely.
People are dying left and right, literally.
Military health system officials addressed the delay in a statement to InvestigateTV Plus, writing in part, "Nothing is more important to Department of Defense leadership than taking care of our people and ensuring their mental and physical health and well-being. The implementation of any new policy can be complex, and while we understand the urgency, we are committed to getting this right."
It's a very significant shift.
Dr. M. David Rudd is a psychologist at the University of Memphis who's spent years studying mental health and suicide in the military. And though he feels the Brandon Act is a big step in the right direction, Rudd says its implementation illustrates just how slowly the system moves.
It will actually help if it's done appropriately. If it's implemented and people are genuinely allowed to pursue care in a confidential environment and they're given the time off, they're given the resources that they need to pursue care, then it'll be helpful. It'll be effective.
How do you think the military can ensure that that happens?
Well, there are only a couple of ways. People that are in authority positions respond to what you evaluate. If you make this a part of how local leaders are evaluated and assessed in terms of their effectiveness, they'll respond. If you don't, they're likely not to respond.
My message to them is to continue to expect oversight from this congressman. Because in the same way that I pushed you month after month to actually get it done, DoD, now I'm going to make sure it's actually working.
The DoD has said all service members will receive annual training, and in response to our questions, officials said it is mandatory for commanders and supervisors to honor a Brandon Act request, adding, "Non-compliance will have consequences."
We're going to hold the military accountable, but we've got their commitment. They're going to hold themselves accountable. That's very important.
Still, the Casertas hope to further expand the law that bears their son's name, which is why we found them back on Capitol Hill in late 2023.
We want a poster in every workspace. We want to add some other elements to it to enforce it more.
A mom and dad on a mission.
I could just hear him say, "I knew you guys would push it through and see it through. I also know that you would never let me down."
And in their advocacy, Brandon lives on.
His legacy is intact, and it means a lot to us, and we know it means a lot to him.
The Casertas say they want to ensure troops know their rights under the Brandon Act. They hope to travel the country, visiting military bases and communities to spread that message. They've also started a foundation in Brandon's honor. You can learn more at thebrandonact.org. And again, if you or someone you know is struggling, the National Suicide and Crisis Lifeline is available right now. Just dial 988. Service members and veterans can then press 1 to be connected directly to the Military Crisis Line.
Still ahead on Investigate TV Plus, new tech could help thousands of people with lung cancer.
Anytime you hear, well, it's new, you're going to be one of the first that's had it done, you start thinking, oh, Lord, do I really want to do that?
How it works and one patient's success story.
Plus,
for women in aviation,
showing young girls to aim for the sky.
it shows them that they can be here.
How women are taking girls under their wing to show them a possibility of a career in science and technology. Lung cancer is the leading cause of cancer deaths in the U.S., accounting for 1 in 5 of all deaths. That's according to the American Cancer Society, which estimates in 2024 more than 234,000 Americans will be diagnosed with lung cancer. When it comes to battling the disease, a Missouri hospital has a new tool in its arsenal.
Reporter David Amilati shows us how the cutting-edge technology has already helped to save one patient's life.
I drink coffee all day long.
In Ellsbury, Missouri.
Quite a bit of difference.
80 minutes out of St. Louis.
You can't ask for better weather than this.
64-year-old Scott Carter sits on his front porch to let his mind unwind.
When you're sitting out here by yourself, you can't help but think about what's coming and what your odds are, what they could have been, how things could have been different.
Carter faces the biggest hurdle of his life, lung cancer.
I don't know, it really didn't surprise me. I don't know why. I don't know if you want this on there, but I got so many other things wrong with me. It's like, you know, get in line.
For years, pulmonologists said they couldn't do much until Dr. Alex Chen with Washington University and Siteman Cancer Center said there was a new way to explore Carter's lungs.
Anytime you hear, well, it's new, you're going to be one of the first that's had it done, you start thinking, oh, Lord, do I really want to do that?
That tech is a robotic bronchoscopy, the only device of its kind in the region.
This technology is being utilized more frequently now.
What makes this robot a technological advancement is this scope.
The ability to articulate and bend in different angles and create angles that we might have challenges doing. This is really the area that I think that these technologies might be beneficial.
Dr. Chen and his team has spent the last 6 years helping develop this robotic from conception to the operating table.
This direction here, going to the right side.
The patient's CT scan is digitized, allowing Dr. Chen to create a map of the patient's lungs to locate the nodule. This is Scott's CT scan, and this is Dr. Chen inside Scott's lungs making his way to the nodule. Here, you get a better idea of the scope's ability to bend and navigate inside someone's lungs. This is how Dr. Chen and his team found the nodule was cancerous and growing. Dr. Chen says a diagnosis is the best gift he can give to a patient.
If we were able to capture patients at an earlier stage, which is the crux of lung cancer screening, it's a different disease entirely. And what that means is we can potentially cure those patients and they have an incredibly good outlook for the future.
I think maybe a lot of people are more afraid of finding out they got it, and so they don't want to go and find out. I don't know, that's really stupid.
Carter has between stage 1 and stage 2 lung cancer. He says doctors say they can remove the nodule and expect him to be cancer-free without the need of chemo or radiation.
I think I got very lucky. It seemed like everything is kind of falling into the right place.
With a more positive outlook, Scott is back in Lincoln County on his front porch to think about life and his future cancer-free.
Sometimes it's kind of hard to put in words.
But you love it.
Yeah, oh yeah. It's, I wouldn't have it any other way than like this right now. I mean, this is great.
The American Cancer Society says the most common symptoms of lung cancer are a cough that doesn't go away or gets worse, chest pain, and shortness of breath. The CDC recommends annual lung cancer screenings for people who smoke now or have quit within the past 15 years, and people between 50 and 80 years old.
Still ahead on Investigate TV Plus, disease threatens a pollinator that helps power our planet.
The only treatment is to literally dig a ditch and burn your hives.
We speak to researchers who help develop a potentially hive-saving treatment.
Plus, when it comes to equality in the workforce, it's not simple math.
Men aren't the problem and women aren't the answer.
How groups across the country are working to get more girls on a path to a laboratory.
You can watch Investigate TV Plus anytime online. Just subscribe to our YouTube channel at Investigate TV. You can catch stories and full episodes. If you've ever used a windshield wiper, a home security system, or even the bulletproof material Kevlar, you have in part a woman to thank.
Women have long contributed to important scientific discoveries and inventions that shape our world. But they're still underrepresented in the fields of science, technology, engineering, and math, or STEM. According to the Bureau of Labor Statistics, men and women represent similar proportions of the total workforce. But recent data shows women make up just 26% of STEM workers. As demand for scientists, engineers, and programmers grows, experts we spoke to say there's an opportunity to close a gender gap and inspire girls to innovate. For Sanaya Nesbitt, the dream is already there.
Coding is everything.
It's the tools that are needed.
If you're using your TV, it had to be coded for it to work. Your phone, it had to be coded in order for you to be able to use your apps.
The high school junior from Omaha, Nebraska joined the Emerging Ladies Academy, where she learned how to build websites and work with robotics. The nonprofit, led by Tiffany Gamble, provides tech training to young women in computer science and engineering.
I am helping the girls expand their mind around technology. It's not just sitting behind a computer screen, right? But understanding the softwares that are used in your industry, understanding the tools that are used within that industry.
Gamble's talking about science, technology, engineering, and math are STEM industries, where the U.S. Census says women are, quote, vastly underrepresented. According to the Bureau of Labor Statistics, in 2021, just 24% of computer occupations were held by women. Engineering jobs, just 15%. A gap Karen Peterson from the National Girls Collaborative Project has been working to close for decades.
Men aren't the problem and women aren't the answer. We all have a variety of ranges of skills and understandings and perspectives, and we need to bring those all into the mix to have success.
Since 2002, the nonprofit has connected 20 million girls to thousands of organizations in 41 states to educate and mentor them on the path towards STEM careers.
If you can see it, she can be it, right?
That same idea is taking off at Atlanta's airport.
Welcome aboard Women in Aviation.
These teens are part of Delta Airlines' WING program, or Women Inspiring Our Next Generation.
Are you excited?
When they board the plane, they'll see aviation professionals who look like them: the pilot, the flight crew, gate agents, and even the ground crew, all women.
At about age 5, girls start realizing or making the assumption that their gender cannot do anything that they want to. Just subtle things in society that make that happen. So they don't look and say, I could be a pilot, or even think that's an idea, or a mechanic. Like, they don't see girls in those roles, so they don't know that they can aspire to that.
Delta says about 6% of its pilots are women.
It's basically somebody else living out my aspirations.
One of them is Gatlin Ligon, who participated in the WING program as a teen herself.
It shows them that they can be here, and for me, when I took this flight, the female pilots on the wing flight were the first female pilots that I had ever seen.
Just one example of showing girls when it comes to careers in STEM, the sky's the limit. You know, when I was a little girl, no one ever asked me, do you want to be a pilot? Do you want to fly a plane? So just exposure helps.
I know both of us are parents of 2 girls, and I tell mine all the time, you can do whatever you want. It doesn't matter, just go for it.
Yeah, have that opportunity now. Karen Peterson says it's never too early to get your child interested in innovation. You can find a STEM initiative or program in your area at ngcproject.org. The NGCP doesn't exclusively serve girls. Since 2002, it's connected 10 million boys to education programs.
Still ahead on Investigate TV Plus, for many beekeepers,
That's what you want to see.
it's more than honey that's sweet.
Just the wonders of a bee.
But watch the sting.
Once here, once here, once here.
How professionals and hobbyists are helping hives thrive. You can watch Investigate TV Plus anytime streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. They're free to download. It might be hard to believe. This tiny insect has a big responsibility. According to scientific journal American Entomologist, honeybees pollinate 1/3 of the food we eat. As beekeepers fight a rise in colony loss due to factors like disease and extreme weather, there's a new buzz about saving the bees from the experienced.
I started beekeeping when I was a kid in junior high school, 1962.
To new and curious minds.
When I started to know bees better, I started to like bees.
There are efforts across the country to save the pollinator that helps feed families. The University of Georgia developed what could be one of the most effective ways to keep hives alive.
Reporter Abby Kasouris shows us how the bee vaccine works.
It's not simple keeping bees.
Dan Long cares for millions of bees in Athens.
Now that's what you want to see.
This is a healthy hive, but this one won't last much longer.
There's hardly any bees left in here at all. They're definitely just about done for this world.
Roughly 40% of beehives die every year because of a lack of food, harmful pesticides, and bacterial diseases that weaken and kill colonies, like American foul brood.
The only treatment is to literally dig a ditch and burn your hives.
Long lives just a few miles away from UGA's College of Veterinary Medicine, where Dr. Lewis Bartlett is running trials on Dalen Animal Health's bee vaccine in the Bee Lab.
Forbes magazine just listed this as one of the top 100 inventions of the year.
Here's how it works. Researchers make a candy cocktail with the vaccine that's consumed by the worker bees. Then they feed the vaccine to the queen. She eats it and it's transferred to her millions of offspring in the hive.
There's the queen.
This vaccine could lead to more vaccines to protect honeybees from other diseases. It's groundbreaking technology that could help other insects.
Absolutely incredible the way it works. The fact that her attendants feed it to her, think the potential to vaccinate against it is just tremendous compared to treating for it.
And that's it for us on Investigate TV Plus. I'm Tisha Powell.
And I'm Lee Zurich. Thanks for watching.
On the next Investigate TV Plus, a deadly disease often goes undetected until it's too late.
I saw this like ascites or fluid in my abdomen around my liver, and usually that's not something good.
We examine why routine checkups don't detect ovarian cancer and the breakthroughs that could change lives.